So COVID-19 is obviously a novel virus, and there's still much that we are learning about it. We already know a lot about different respiratory illnesses and smoking. We know that smokers are more vulnerable to contracting respiratory illnesses, and when they get them, those illnesses are more severe and more likely to result in poor outcomes and take smokers longer to recover from. From the data that we have so far, it would appear that smokers are more likely to get COVID than non-smokers, and that when hospitalised, smokers have more severe outcomes. So it's kind of what you might expect from a respiratory illness. But the data is still growing, and we're still trying to understand, what this novel virus is and what the impact is on smokers. So I would separate out vaping and water pipe or shisha smoking. They're two really different activities. So shisha or water pipe smoking is still tobacco smoking. You are still taking smoke into your lungs, and it poses very similar risks to smoking cigarettes. The additional risks that might come with shisha smoking is that it's often something that is done communally, and pipes are shared between people. So the risk of transmission of infections is greater in that situation. But vaping is really different. So e-cigarettes, vaping products don't contain tobacco. They're not smoked products. You're not inhaling tobacco smoke into your lungs. And it doesn't pose the same risks or create the same vulnerabilities that smoking tobacco smoke does. In fact, smokers who are trying to quit smoking and are using e-cigarettes or vaping products to quit, this should be protective. We can see that smokers who completely switch to using vaping products, are less likely to have a range of adverse health outcomes than smokers who continue to smoke. Ash are leading a campaign to call on smokers to quit for COVID. It's a campaign that was inspired by a GP in Bristol who was meeting with his patients who smoked and, responding to the fact that they were very worried about what their smoking might mean for them if they were to contract COVID. So we have launched a website. Today is the day. .org.uk, where smokers can get more advice on how to quit smoking. There is a daily quit clinic on Twitter, which if you search for a hashtag quit for COVID, you'll be able to find it. You can get advice every day about your quit attempt. And we're also really urging smokers to get in touch with their local stop smoking service. The services are still out there. They're still able to provide support to people. We know this is a time when smokers are really motivated to quit smoking, but not enough of them are going to get support from the services that are still out there to help them. Stop smoking services are finding a load of innovative ways to work with smokers at the moment who want to quit. Many of them have moved onto telephone systems and are supporting people over the phone. They're also using text message systems and different kinds of apps and emails. And some of them have managed to move on to video conferencing as well. There's advice out there for stop smoking services who might want it on the best ways to support smokers. And I would recommend that they look at the guidance that's been produced by the National Centre for Smoking Cessation and Training, the NCSCT, for services who are looking for more advice there. But there's lots of different approaches that services are taking. And also working really hard to try and get people the medication that they need to quit. We're seeing people use lots of different ways to get NRT to people, from using the NHS volunteers to deliver nicotine replacement therapy to people's doors, to using online prescribing systems and everything else in between. So there's a lot of innovation out there, and services that want more guidance should look to the NCSCT. Smokers who want support to quit should get in touch with their local service and find out what's available. Well, it's a really interesting idea to have a look at whether nicotine could act as a protective factor in the development of COVID symptoms. It's definitely something that should be explored. You know, any possible treatment at this stage should be looked at. But for smokers who are thinking that this maybe is a reason not to give quitting a go right now, I would say that all the evidence suggests that that's not true. That your risk from smoking is much greater than any potential protective effect from the nicotine. But what it does say is that if there's a chance that nicotine might be protective, then there's no harm in using it in your quit attempt. And what we do know is that if you do use adequate nicotine in your quit attempt, you're much more likely to be successful in that quit attempt. So smokers who are thinking, oh, perhaps I won't give it a go, I would say do, but get yourself an e-cigarette, get yourself a nicotine patch or nicotine gum, use some alternative source of nicotine, because if there's any protective effect, it's going to be from the nicotine, it's not from the tobacco smoke. We know that that's lethal.